Hey everyone, welcome back to Zen Zone Health, your trusted source for practical health tips and information. Today we're diving deep into a serious topic, blood clots. We'll uncover 7 silent symptoms that often go unnoticed but could indicate a potentially life-threatening condition. Stick around as we break down these warning signs and empower you to take control of your health. Let's get started. Our first silent symptom might surprise you: discolored skin. Blood clots can disrupt the normal flow of blood throughout your body. When blood flow is compromised, it can cause certain areas of your skin to change color. You might notice the affected area becoming paler than usual or redder. This redness is a sign of inflammation and can indicate that your body is trying to fight off a potential issue. If you notice discolored skin that's also cold or clammy to the touch, especially in your legs, it could be a sign of deep vein thrombosis, or DVT. DVT occurs when a blood clot forms in the deep veins of your legs. This is a serious condition that requires immediate medical attention. Similarly, bluish discoloration in your skin, particularly in your lips or fingertips, could indicate a problem with your circulation or oxygen levels, which could also be related to a blood clot. Our bodies have incredible ways of communicating with us. Paying attention to even subtle changes in your skin can provide valuable insights into your overall health. Never hesitate to reach out to your healthcare provider if you observe any unusual skin discoloration, especially if it's accompanied by other symptoms. Let's talk about leg cramps, a common ailment that can sometimes signal something more serious. Persistent leg cramps, especially in the lower part of your legs, should never be ignored, as they could be a warning sign of a blood clot. Deep vein thrombosis, or DVT, is often associated with cramping and discomfort in the affected leg. The pain can range from a dull ache to a sharp, stabbing sensation. Prolonged immobility, such as sitting for long periods during travel or being bedridden after surgery, can significantly increase the risk of blood clots forming in the legs. If you've recently been on a long flight or have had limited mobility and you experience persistent leg cramps, consult with your healthcare provider to rule out the possibility of DVT. Early detection is key when it comes to blood clots. Now let's talk about another subtle yet significant symptom: warm skin. A noticeable and persistent warmth in a specific area, particularly in your legs, should raise a red flag. This localized warmth can be a sign of inflammation and could indicate a blood clot forming in that area. When a blood clot obstructs blood flow, it can cause a buildup of pressure and inflammation, leading to increased warmth. This warmth is often accompanied by redness and swelling, further suggesting a potential clotting issue. When combined with other symptoms like persistent leg pain, swelling, or discoloration, it's crucial to seek medical attention promptly. It's always better to err on the side of caution when it comes to your health. Back pain is a common ailment that affects people of all ages and fitness levels. While most cases of back pain are related to muscle strain, injury, or poor posture, there are instances where back pain can be a sign of something more serious, such as a blood clot. Severe lower back pain that seems to linger without a clear explanation could indicate a blood clot in the inferior vena cava, or IVC. The IVC is the largest vein in your body, responsible for carrying deoxygenated blood from your lower body back to your heart. When a blood clot forms in the IVC, it can partially or completely block blood flow, leading to persistent lower back pain. The pain associated with an IVC blood clot is often described as a deep, throbbing pain that's unrelated to any specific movement or activity. If you experience sudden, severe lower back pain that doesn't improve with rest, over-the-counter pain relievers, or home remedies, seek immediate medical attention. Swelling, a visible sign of trouble. Persistent and unexplained swelling, especially in your arms, legs, hands, or ankles, should never be ignored. This type of swelling could be a sign of a blood clot obstructing the smooth flow of blood through your veins. Deep vein thrombosis, or DVT, commonly causes swelling in the affected leg. This swelling occurs because the blood clot prevents blood from flowing back to the heart as it normally would, leading to a buildup of fluid in the surrounding tissues. The swelling associated with DVT can be quite noticeable, causing your leg to appear larger than the other. It can also be painful and tender to the touch. If you press on the swollen area, it might leave a small dent that slowly fills back up. This is called pitting edema and is a classic sign of fluid retention. Shortness of breath, A medical emergency. Sudden shortness of breath requires immediate medical attention. Pulmonary embolism occurs when a blood clot, often originating from the legs, travels through the bloodstream and lodges in the lungs, obstructing blood flow. This blockage can be life-threatening, as it prevents oxygen from reaching the rest of your body. The shortness of breath associated with PE often comes on suddenly and unexpectedly, even when you're at rest. Along with shortness of breath, PE can also cause chest pain, a rapid pulse, and even a drop in blood pressure. If you experience any of these symptoms, especially after a recent surgery, prolonged immobility, or a known history of blood clots, call 911 or get to the nearest emergency room immediately. Excessive sweating. Don't ignore this sign. While sweating is a natural bodily function, unexplained and excessive sweating can sometimes indicate a serious underlying condition, including blood clots. When a blood clot forms in a vital organ like the lungs or heart, it can disrupt blood flow and put a strain on your cardiovascular system. This strain can manifest as excessive sweating, even when you're not overexerting yourself or in a hot environment. The sweating associated with blood clots is often described as a cold sweat, and it might be accompanied by other symptoms like chest pain, an irregular heartbeat, or difficulty breathing. If you experience sudden, unexplained sweating, especially if it's accompanied by any of these additional symptoms, seek medical attention promptly. And there you have it. 7 silent symptoms of blood clots you should never ignore. Thanks for sticking with me today on Zen Zone Health. Early detection and treatment of blood clots are crucial in preventing life-threatening complications. If you found this video helpful, please give it a thumbs up, share it with your loved ones, and hit that subscribe button to stay updated on more health tips and information. Stay healthy, stay safe, and I'll see you in the next one.